Hello, fellow City of Chesapeake employees. My name is Allison Myers, and I'm the Director of Human Resources, and I will be facilitating the training you will be taking today. The training today is for the Virginia Occupational Safety and Health Requirements. This is the training required for lower and medium risk of exposure of COVID-19 and is the initial training for employees at high risk of exposure of COVID-19. Departments will assess their workplace for hazards and job tasks that can potentially expose employees to the SARS-CoV-2 virus, also known as novel coronavirus or COVID-19 disease. Employees will be classified according to the hazards they potentially are exposed to and the job tasks they undertake into 3 categories: high, medium, lower. Employees exposed to the same hazards or performing the same job tasks may be grouped for classification purposes. The purpose of this training is to provide information to all employees on the existence of a new regulation through the Virginia Occupational Safety and Health Department program, including general awareness of the hazards and characteristics of SARS-CoV-2 and the symptoms of COVID-19 and measures to minimize exposure. This training is offered to comply with the training requirement for employees identified as lower and medium risk level of exposure. Employees with high risk levels of exposure will be required to complete this training as well as additional training regarding mitigating the risks associated with the SARS-CoV-2 virus and COVID-19 disease. Employees should review documents posted on the city's SharePoint site related to the COVID pandemic. Documents include, but are not limited to, City Manager Directive, COVID-19 Exposure Policy, and COVID-19 Exposure Guidance Flowchart. The topics that will be covered during the training today are characteristics and methods of transmission of the SARS-CoV-2 virus, signs and symptoms of COVID-19 disease, risk factors of severe COVID-19 disease, and the impact of pre-symptomatic and asymptomatic COVID-19 persons transmitting the SARS-CoV-2 virus. In addition, we will cover safe and healthy work practices and control measures, personal protective equipment or PPE, anti-discrimination provisions, the city's infectious disease preparedness and response plan, which is applicable to medium and high-risk employees, and additional training. First, we will cover definitions. Asymptomatic means someone not showing the signs and symptoms of COVID-19. Close contact means being within 6 feet of another individual for 15 or more minutes. COVID-19 means coronavirus disease 2019, primarily a respiratory disease caused by the SARS-CoV-2 virus. Lower risk of exposure means not otherwise classified as very high, high, or medium exposure risks that do not require contact within 6 feet with persons known to be, suspected of being, or who may be infected with SARS-CoV-2 as otherwise provided in this definition. Employees in this category have minimal occupational contact with other employees, other persons, or the general public, or are able to achieve minimal occupational contact through the implementation of engineering, administrative, and work practice controls. SARS-CoV-2 means beta coronavirus, like MERS-CoV-2 and SARS-CoV-2, also known as novel coronavirus. The SARS-CoV-2 causes what has been designated as the coronavirus disease 2019 or COVID-19. Finally, symptomatic is someone who is experiencing symptoms similar to those attributed to COVID-19, including fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. Symptoms may appear in 2 to 14 days after exposure to the virus. Work practice controls may include installation of floor-to-ceiling physical barriers constructed of impermeable material and not subject to unintentional displacement, such as clear plastic walls at customer service windows, behind which only one employee is working at one time, telecommuting, staggered work shifts that allow employees to maintain physical distancing from other employees, other persons, and the general public, delivering services remotely by phone, video, mail, package delivery, etc., that allows employees to maintain physical distancing from other employees, other persons, and the general public, and mandatory physical distancing of employees from other employees or persons and the general public. Employees use of face coverings for contact inside 6 feet of coworkers, customers, or other persons is not an acceptable administrative control or work practice control to achieve minimal occupational contact, except when necessary for brief contact, not exceeding 15 or more minutes within 6 feet of another individual. Characteristics and methods of transmission of COVID-19. Main transmission occurs when an infected person coughs, sneezes, or talks. Close contact with someone who is positive. It is also important to note that infection can remain on surfaces for up to several days. Individuals can be contagious and thus spread the virus without or before developing symptoms. It is very important that caution should be taken in all interactions with one another, as another individual could be unknowingly carrying the virus. Symptoms of COVID-19 may appear 2 to 14 days after exposure to the virus. Possible symptoms include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle and body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Individuals should seek medical care immediately if the following symptoms are present: trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. Call your medical provider for any other symptoms that are severe or concerning to you. Individuals can avoid contracting or transmitting COVID-19 by cleaning your hands often, either with soap and water for 20 seconds or a hand sanitizer that contains at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are or may be infected. Put distance between yourself and others of at least 6 feet. Cover your mouth and nose with a cloth face covering when around others. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces daily. The CDC recommends that people wear cloth face coverings in public settings and when around people outside of their household, especially when other social distancing measures are difficult to maintain. Use non-contact methods of greeting others, such as avoiding direct physical contact or handshakes. Cloth face coverings may help prevent people who have COVID-19 from spreading the virus to others. Follow call-in procedures for your department to not physically report to the workplace when you experience the signs and symptoms of COVID-19 or are determined to have been at a significant risk of infection due to close contact within 14 days of someone that has tested positive for COVID-19 during that time period. The city has leave policies and procedures available to employees. These include accrued paid time off, annual or sick leave, emergency paid sick leave, leave advancement, leave donation, and short-term disability. Leave provisions vary based on the type of leave an employee accrues. In addition, employees are eligible for 80 hours of emergency paid sick leave. Visit Human Resources SharePoint site for complete information on available leave options. The VOSH standard does not consider face masks to be PPE. However, face masks are separately required by an executive order issued by the governor and city manager and recommended by the CDC. Employees should use face coverings for anticipated or possible close contact, including hallways, bathrooms, and when sharing occupancy of vehicles. As applicable to particular job classifications or work tasks, supervisors are required to ensure that staff are aware when PPE or disinfectant supplies are required, when PPE is required, how to properly don, doff, adjust, and wear PPE, and the limitations of PPE. The city is committed to providing a safe working environment in compliance with all relevant law and guidance. Employees should report any safety concerns to their supervisor so their concerns can be addressed. The city will not discharge or discriminate against any employee who has exercised rights for themselves or others under the safety and health provisions of Title 40.1 of the Code of Virginia and implementing regulations, voluntarily provides and wears their own personal protective equipment, including but not limited to a respirator, face shield, or gloves, or face covering if such equipment is not provided by the city, provided that the PPE does not create a greater hazard to the employee or create a serious hazard for other employees, or raises a reasonable concern about infection control related to the SARS-CoV-2 virus and COVID-19 disease to the city, the city's agents, other employees, a government agency, or to the public, such as through print, online, social, or any other media, or refuses to enter the workplace or to complete an assigned task because of a reasonable fear of injury or death. Employees should contact Human Resources if they feel they have been discriminated against for reporting a safety concern to their chain of command. Human Resources will investigate the complaint to determine whether the employee's concern was reasonable and whether it was adequately addressed by the chain of command. Heat-related illness prevention. Signs of heat stroke and heat exhaustion include cramping of muscles or stomach, weakness, fatigue, headache or dizziness, vomiting, confusion, profuse sweat or absence of sweat with elevated body temperature or unconsciousness. Face mask tips for extreme heat include using a breathable fabric, such as cotton. Light colors will absorb less heat. Wash your mask after each daily use and carry a spare to reduce discomfort from sweat. Don't wet masks, they compromise filtration. Stay well hydrated and take breaks to cool your core body temperature. Wearing a mask in high temperature does increase body temperature around the face. Heat stress prevention. Schedule the heaviest, most strenuous work early in the morning. Rotate employees performing heavy, strenuous work. And establish cooling stations such as shade areas, public buildings, or vehicles with air conditioning and supply cold liquids. Remove face masks when over 6 feet apart from other individuals. Additional training may be required due to changes in the workplace, SARS-CoV-2 virus or COVID-19 disease hazards, changes made to the city's infectious disease preparedness and response plan, or inadequacies in an affected employee's knowledge or use of control measures, which indicate the employee has not retained the requisite understanding or skill. The next set of slides will discuss the medium risk classification. VOSH's emergency standard requires classification of job tasks by the risk levels below: very high, high, medium, lower. First, it is important to understand the VOSH standard. The purpose is to protect employees from transmission. It requires hazard assessments for each job, categorizing them as very high, high, and medium. Employees are required to conduct self-assessments and stay home when sick or contagious. Employees will be screened with temperature checks in certain areas. It allows flexible leave policies and work schedules when feasible, and limits the spread of the SARS-CoV-2 virus through engineering, social distancing, disinfection practices, and use of PPE. In addition, PPE will be provided when necessary. The VOSH standard limits known or suspected infected employees from reporting to work, requires notification of employees and other contact individuals of possible exposure within 24 hours, requires that the city develop an infection control plan, requires mechanical ventilation systems will be maintained in accordance with manufacturer's requirements, training is required for basic compliance, and finally, discrimination is prohibited. VOSH has classified hazard level exposure in 4 categories: very high risk for invasive medical procedures, high risk, which is typically public safety or medical procedures requiring close contact, medium, which is the intent of this section of the training, for contact within 6 feet of another, such as work crew teams, individuals in shared vehicles, juvenile detention staff, recreation staff with children, child protective services, and cashiers, and lower, which is typically staff that can maintain 6 feet of social distancing or have adequate plexiglass barriers or walls, work independently, or telecommute. Medium risk is associated with contact within 6 feet of other employees. Medium risk tasks may include operations employees working closely in teams, work crews sharing transportation, working with children or residents, individuals working in close spaces, individuals making home visits or inspections, individuals providing personal care, or healthcare workers in settings without known or suspected sources of SARS-CoV-2. The VOSH standard requires a hazard assessment. The assessment is conducted by designees within each department. It's conducted by job tasks. It identifies hazard potential. It identifies work protective requirements and/or PPE. It includes employee input, and the results of the assessment are communicated to employees. Protective measures include developing administrative practices that include wearing face masks within 6 feet of another employee, which is a city requirement, wearing gloves if handling money or other material exchanged with other persons, providing hand sanitizing material and/or opportunities to wash hands, reducing the size of work crews working close together, and frequently cleaning high-use areas. The city has an operational infectious disease control plan for COVID-19. The highlights of the plan include a health safety officer overseeing compliance, job assessments are completed and reviewed, contingency plans are disseminated as needed, ensuring infection control measures are initiated, requiring employees self-assessment and workplace screening, allowing employees to participate in hazard assessment evaluations, and communicating employee safety concerns is encouraged. In summary, you should have learned about general training provided on the SARS-CoV-2 and COVID-19 disease, methods of transmission, best work practices by specific job task, engineering, administrative, or PPE requirements for specific job tasks, additional policies and procedures to safeguard employees, and opportunities for employee feedback. Employees are encouraged to give their supervisor feedback on this training and any safety concerns. If you have any questions regarding the training you attended today, please contact your department director or human resources at hrbenefits@cityofchesapeake.net with questions. Thank you.